Now I'm going to dive into a case study. So this is fictitious, but it's very, very realistic. This is very representative of people that we work with at our pain clinic day in, day out. So Richard is a veteran who was injured in a motor vehicle accident while deployed overseas. He's paraplegic with severe chronic neuropathic pain in both of his legs. He was seen in another pain clinic 7 years ago. That clinic was predominantly doing interventional management, and he failed to respond to all treatments, unfortunately. Infusions, injections, spinal cord stimulation. He's still having quite a bit of pain. So at the time that Richard is actually being referred to our clinic, he's on 290 milligram of morphine equivalent daily. But despite the fact that he's struggling with his pain on a daily basis, 8 out of 10 to 12 out of 10 pain, he's really pushing himself to be active, in line to participating to Paralympics. And he is also really pushing himself to be present to his family. But this is not the life he wants for himself or his family. So before the implementation of Step Care 2.0, if Richard had been referred to our clinic, he would have been seen by a physician first, and he would have been waiting for 2 years actually between the time of his referral to the medical visit. Then he would have been referred to either psychology, occupational therapy, physiotherapy, social work, or to our intensive 80-hour chronic pain management rehab program. And for that, he would have had to wait another 6 months. After we implemented Step Care 2.0, as soon as Richard would have been referred to our pain clinic pre-COVID, he would have actually been invited to participate in an orientation and education session where he would have learned about a lot of resources he could access right away to help manage his pain. Now, post-COVID, our wait is about 3 to 4 months. Then he would have seen his physician, and then he would be referred to our interprofessional team for a group intake where we go more in depth into chronic pain and its management. We go over all of the programming that's available. And the good news about this is that Richard does not wait between his medical visit. If he's referred to our interprofessional team today, he's scheduled into that session next week. And then he gets to meet one-on-one with a member of our team and to make a personalized treatment plan. And again, for that, there's no wait. Next week, he meets, he goes into his group intake. The following week, one-on-one personalized treatment plan. And this is what we learned from Richard. So his goal is to reduce his reliance on medication, improve his sleep, sleeping 3 to 4 hours a night, very broken up sleep, and reduce the number of days off due to pain crises. In his meeting with a therapist, he tells more of his story. He's really caught into a push-crash cycle. When he's doing a bit better, he just push to do as much as possible, and then he crashes for 3 days. A lot of self-loading went down. He's not coping well, sometimes using his medication and alcohol. Anxiety is present. He has a previous diagnosis of PTSD, but he doesn't feel it's much of an issue. He responded well to treatment, and the service dog was super helpful. So this is what his treatment looks like at our clinic. Might look like at our clinic. So first, he's invited for participating in a sleep workshop and a pacing workshop. Let's get some strategies right under his belt. And then he participates into our 4-week distress tolerance and emotion regulation skills group. Once he's got this foundation, he comes into our 20-hour chronic pain rehab program. He declined the intensive. It was not quite the right fit for him. In phase 3, sleep is still an issue. He's improved in terms of his ability to pace, his ability to manage pain. His actually reliance on medication, PRNs, has reduced, but he wants to get into his sleep issue. He participates in our 4-week behavioral therapy for insomnia. And there, during that treatment, he learns about mindfulness a bit more and wants to participate in our 8-week mindfulness pain management. So he's, can go into it right after he finishes the CBT program. Afterwards, Richard is actually feeling quite a bit better. He's had his appointment with his physician, with the members of our team, and we're looking at how do we maintain those gains. In phase 5, he basically decides that he's going to enroll in our drop-in online mindfulness session. He's invited to do that, to drop in anytime he wants on a weekly basis.